Member, Agency Director, Authority Member Doris.
Here.
Molly.
Present.
Mann.
Present.
Vice Mayor, Vice Chair Chris.
Present.
Mayor Chair Paris.
Here.
We have a quorum.
Thank you. Who's doing the invocation tonight? Anyone? I will do the invocation. If everybody could bow their heads. Our Heavenly Father, please forgive us our many sins and transgressions, and we humbly ask that you protect our city during the ravages of this plague. We are grateful for all that you have given us and for sending us some Samaritan's Purse to save our citizens. And we ask that you soften the hearts of LA County Public Health so that they will give us our share of the vaccine so we can continue to save the lives of our people. In Jesus' name, amen.
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 Okay, moving on. Oh, and this is the ACLU day. I gave them something else they can sue me for. Isn't that right, Allison?
Yes, sir.
All right. Anything to be removed?
No, sir.
Thank you. Is there a motion to approve the minutes?
So moved.
Is there a second?
I second that.
If we could call the roll.
City Council Member, Agency Director, Authority Member Doris.
Aye.
Molly.
Aye. Yes.
Mann.
Yes.
Vice Mayor Chris.
Yes.
Mayor Paris.
Yes. Moving on to 81, the COVID-19 pandemic update. Are all the vice mayors present?
We are.
Maria Altamirano is, I got it, didn't I, Maria? You can check in if you want.
Yes, you did.
Thank you.
Yes, you did. Altamirano.
Is Tiffany Tanner here? I don't see her. Okay. Do we have a COVID report?
I do. Let me put it up. Can everyone see the full screen?
Yes.
Yes.
So we start at the top as usual. Right now, in the world, we have over 100 million cases, 2 million deaths. As you can see here, in the past 14 days, there's been a improvement in the new cases and also a 10% drop in new deaths. So that's good news. Where are the cases? The United States again leads the world in total cases, new cases, deaths, and also new deaths. The map on the right tells you where the hotspots are. Again, the United States is in the moderate range. Looks like Spain and Portugal is even worse off than the United States. And then Western Europe, England, Sweden. South America is also not doing too well. But the continents of Africa and Asia and Australia looks like they're doing okay. Going to the United States, we are at 27 million cases and for about 500,000 total deaths. California, again, carries the burden, total of 3 million with more new cases, more deaths than any state. Actually, New York has more total deaths than we are, but we're very high in terms of total cases. The map on the right actually is better. If you recall, 2 weeks ago when I presented, it's mostly purple in the southern part of the United States. But for the most part now, it's light yellow, which is few, maybe orange. Looks like Texas is still very purple in some areas. This map tells us the risk of getting an infection based on time. So in September, the hot cases were in this area. In December, when all the Thanksgiving, Christmas, all those times, all those people gathered together, basically it was a really bad time. Now, as of February 7th, it looks like a large chunk of the United States is improving. There are still hot areas. Again, the usual states, California, Texas, Florida, and the southern Sun Belt. Let's go to California. Okay, and then for California, the 7-day average and the new cases, it's also dropping. So it looks like we are over the Christmas, New Year's surge, and deaths are now also tapering off favorably. So that's those are all good news. Going to California, LA County is the top in total cases, new cases, and deaths. So we are still leading the state in terms of infections and deaths. Going over to the colored map here, it looks like, if you recall, we used to be in the purple range. Now we're in the lighter range, less cases per 100,000, which is a favorable news. Here is the graph of all new cases. It looks like, as you can see, a significant drop over the past days, and at the same time, deaths are also dropping as well. So it's good news for the state and for LA County. Going to the county, these are our numbers as of the 8th, and basically we're at 1.1 million total, 2,700 new cases. Testing continues to drop off, and positivity rate is really favorable at this point. If you look at this graph, the average now is at 9.20%, which is really good. The goal is to get to near 5%. That'll basically tell us that we're very comfortable. Deaths have also dropped. The death rate is at 165 per 100,000, and same group of people are carrying the burden of death. Hispanic, Latino carries the most, and high poverty areas also carry the most. Here, this slide shows hospitalization also substantially reduced, very favorably. This is daily deaths and daily cases. As you can see here, the light blue daily cases, very precipitous drop, and daily deaths also dropping as well. This map tells us what part of the county is still seeing a lot of cases. The light blue here is Lancaster. Medium blue here is Palmdale, Acton, Santa Clarita. There's a block here, an area here that's medium blue and dark blue. It's basically Saugus, and we're not sure why that's the case. San Fernando Valley, East San Fernando Valley, medium blue, similar to Palmdale, and then the rest of LA and East LA County. This graph is an updated graph of where the cases are happening. Here, this is cases per population. The cases is dark blue and population is light blue. And as you can see, a lot of the cases are in the younger population. And in the older population, it's less. However, when you go to the deaths, for example, look at the 80-year-old deaths, it's the highest. So very few people in the 80s get infected, but when they get infected, it's a 40% plus death. So it's substantial demographics. In the Antelope Valley, we have a younger population, so we have a lot of infections, but our deaths so far have been favorable or less. This is the national reported. Every hospital calls in and reports these numbers, and this is a comparison of what's happening in terms of hospitalizations and ICU beds. So, for example, for California, the average ICU occupancy is 87%, course, national average is 76%. When you look at hospitals nearby, Providence and Mission Hills is 99, 94. Henry Mayo is at 83. Simi Valley is at 76. Going over to Antelope Valley, we're at 96% at AVH, ICU occupancy, and a little bit better at Palmdale Regional. And then this table you've seen before compares the adjusted case rates versus adjusted death rates. And for this week, we are at 12,000 cases compared to 6 weeks ago, about 8,000. And our deaths are 149, which is better than the LA County number. Palmdale struggling both in positive cases, but also in deaths, higher than LA County. Santa Clarita, very favorable. Panorama City, really in bad shape, double the death rate per 100,000. And Woodland Hills, very favorable, 5 times less even than the county numbers.
Dr. Trung, where are you getting your numbers?
Oh, this is on LA County website. You just go to the demographic section, you type in the city, and the case rates come up, and death rates come up, and the population also it comes up. And I just basically copy and paste and add these numbers on. It's at the LA County website. It's the same website that you see this when you log in. This is the same one. It's just a couple of tabs, and you go to all these numbers.
When I'm getting different numbers from them. I mean, it depends on which page you land on as to how they report our population. And that seems to be the biggest disparity, but they're also reporting more deaths than we actually have, depending on which page you land on. It seems to me that they could, I mean, we've got to have some confidence in their numbers. And I can't have confidence in their numbers when you turn the page and they have different numbers. So Don, how do we fix that?
I've never noticed, I've always looked at the same cities, and I've always seen trending upward, but I don't know how to question those numbers. And you're right, you have to trust them. And I use the same tab and the same, just the same sequence of tabs to get there. So I can show you, I can pull it up and show you, when I have, maybe in another 5 minutes when I finish these slides, I'll show you how I access it, and then you can see the numbers.
That's all right. We can work on it after the meeting.
Sure.
They're just different is all I can tell you.
I would add too, Mayor, our staff sometimes when compiling numbers gets, I don't want to say faulty, but late information or different information. So it is a tricky to kind of track all this stuff. You're absolutely right.
Right. I never look at it on Monday morning because the numbers aren't already trued up. You have to wait till Monday evening to do these slides because then everything comes in the afternoon. But yeah, sometimes I see on Wednesday what I report on Tuesday is slightly different, but that's severely. So.
It's the denominator they seem to be using that is different depending on the page, meaning they divide it by our population. Sometimes they divide it by 145,000, sometimes by 155,500, and sometimes by 161,000. I just wish they'd use the same denominator.
Right.
Well, one thing we do, Mayor, is identify that. We'll have staff research through that. If you can send me a link on where you're finding that, and then we can reach out to public health, see if they can correct that.
Okay, great.
That would definitely be helpful. If there's a specific location where you're finding that, we can see if we can do that.
Well, I actually kind of like it because they have our death rate much higher than it is, which means they should be giving us our vaccine, shouldn't it?
Yes. Let's talk about the vaccine. So right now, the biggest fear is the variants. The English, the one in England, the B117, there's now 690 cases, 33 states reporting. The South African strain, the variant, very few, and the Brazilian variant also very few. The South African is very worrisome because the AstraZeneca vaccine is no longer effective. They pulled it off they're no longer giving out this vaccine because it doesn't seem to be working. And the Brazilian one's also very scary because studies have shown that if you had the original Wuhan virus infection in, say, March, and now you get this Brazilian strain, it's another repeat of the disease. So it looks like the variants are evolving, and it's a race between the vaccine developers and the mutants. So nationally, the vaccine rollout, this is from the CDC website. The darker colors means that the population is getting more and the lighter is less. Looks like California someplace in the middle range here. And these are the doses administered year to date. And the average now from the CDC is close to 1.46 million average doses per day. So the projection from the CDC is that if we continue at this rate of vaccination at average daily dose of 902, because you have to account for the second dose. Even if you're giving 1.5 million doses a day, a big number of them is to give to the second dose. So at this current pace, to get to about 70% of the population vaccinated, we will then we probably reach a herd immunity by September if this continues this rate. Hopefully, we could go faster, but that's where the projections are from the CDC. And then in the same LA County website, you can pull up, there's a link for how they're doing in their vaccinations. And from that link, I got this screenshot. As of 2/4, as of February 4th, they've given out a million doses, and of that, 204,000 total second doses. And then they have this table which tracks the vaccine shipment arrivals since December the 14th and how much they've given out. And as you can see at the beginning, it's 60%, then 30%, 40%. But at least in total, they say as of February 1st, they've given out a total of 82%. That's pretty impressive. So they're saying they're getting what they get, and they're giving it all out, a lot of it out, with little wastage. And that's all I have. Let me stop the show.
I would add a note, Mayor. We had a meeting with the deputy mayors earlier, and so we have staff researching. I understand that there is data out there as it relates to zip code and who has received the vaccine by zip code. So we're trying to track that down. We became aware of that this afternoon. We're trying to track down that stat to see if that sheds light on the need for siting up in Lancaster in the Antelope Valley. So we'll hopefully have that information soon.
I'll give $100 if you get that information. Something tells me they've locked that away in a vault. But it'd be interesting to see what it says. Something tells me it's going to track the low infection rate of some more affluent areas. When can we have that?
It just came. We had a meeting at 3 this afternoon, so I got staff working it, and I'll know more in the morning. Dr. Trong said it might be in the LA Times itself, so if that's the case, it's an easy find, so we'll have it in the morning. If it's not, then we'll dig a little deeper.
Do we have an update on the Kaiser super site?
Yeah, so we had a meeting with them yesterday afternoon. That was more of a planning meeting, so to identify how many volunteers were necessary, what level of service the city needed to provide, what level of service Kaiser was going to provide, and they are thumbs up to move forward, but they've got to get that approved through their departments. Dr. Trong may know a little more detail about their departments and the bureaucracy. I don't want to call it a bureaucracy; it's a process that they need to go through to make sure all those approvals happen, but we're in lockstep with them, ready to rock and roll.
So the way it works is if you want to have your area as a super site, you put in the application to Kaiser region, and it's reviewed by Kaiser Foundation Health, which supplies the medication, the vaccine. And then it's also reviewed by the Permanente Medical Group, which basically provides the malpractice and the physician coverage. And it's going to go through pretty quick. So the application's already in since last week, and we hopefully can provide the super site. We were told about 4 weeks ago that we were getting 5,000 doses of the vaccine in this area for the Antelope Valley. We had 3,300 staff members, so we were giving that out. And once we found out that we had more, we were basically gearing up to give to the community as well. But then those doses didn't really come in. It came in at a lower dose, a lower amount. So we had to pull back and give to the staff first. But going forward, we should have enough to provide for both, for Kaiser and non-Kaiser, once we have the super site available. The numbers we don't know. We don't know when and how many doses comes in. We just get a number. So, okay, you're getting 1,400 doses, and we don't know how those numbers are portioned out. But it looks like we're getting we'll probably get it in a week or two. Get this super site up.
So the assignment of the vaccine will be a Kaiser assignment, not a public health assignment. Is that right?
So when public health gives you the vaccine, Kaiser doesn't own the vaccine. Kaiser has to follow the guidelines. So we have to give it out to whatever the guideline requires. So healthcare workers, tier 1, 1A, 1B, and then the 65 and over, just follow basically what every site would follow. But what I'm asking you is from what I'm hearing from you is Kaiser's going to get this truckloads of vaccine. And then is it Kaiser's decision as to where they allocate it? Not who they allocate it to, but where they allocate it. Well, that's why we're working with the city to make this a super site where we could basically give to hand it out. Of the doses we were given, for example, we gave out 97% of the doses. We didn't waste any at all. So, we give it all out. We don't want to hang on.
Could you move? Okay, good. Thank you. All right. We figured that if we can just get the vaccine, we could vaccinate the city in about 20 days with the 2 sites that we're ready to get up and running. Yeah. So Donna, have you got us the vaccine yet?
Let me unmute myself. I'm working on it.
Work harder.
Yeah,
We're working on it.
One anecdote, and I think this is a hope for the community, and Chief Stuckey's on here, and you might want to pop in and say a lot of the fire department has been vaccinated, and they've seen just incredible results. You might want to report on that, Chief.
Okay, can you hear me? I got a new computer. It's possessed.
Yes.
Vaccine.
Yeah. So a couple things on that. The fire department right before Christmas was just getting crushed like everybody else was. We were trending around on any given day between 300 and 400 people that were off on COVID. We started our vaccines internally on December 24th. About a week ago, we finished our second vaccines. A total of 70% of the department accepted the vaccines. And I just got the report. Like I said, we were trending in the 300 to 400 range with 40 to 60 people coming back positive each day. I just got the report about 10 minutes ago. Today, we have 62 people off on COVID and 1 COVID positive today. So accept it or don't accept the vaccines, but internally, not CDC numbers, not any other numbers, true numbers that we're seeing in our department, it works and it's making a drastic difference. So Jason, whenever appropriate, I can touch on the Megapod sites and that if necessary.
Sure. Chief's also working on the strike team for the Megapod, so you may want to touch on that.
Okay, so...
Wait a minute. Before you do that,
sure.
70% took the vaccine. That means 30% didn't. Can we have the 30%? I mean, it's laying around someplace, right?
It's not. It's a use it or lose it, I guess, Mayor, is the best way to put it. And actually, we have about 200 left, and we're scrambling to get those 200 from people that were off sick that couldn't get the vaccine. So the theme is this vaccine shortage everywhere.
Okay, just thought I'd ask. Don't want to leave one stone unturned.
Well, so a couple things, Jason, if you want me to cover that. So I was brought in 30 days ago with the marching orders, stand up 5 megapod sites. The marching orders from the Board of Supervisors and Public Health was 1 per supervisory district. So I'm the lead operations section chief on that. So we've got our 5 mega drive-through sites, and we stood them up prepared to do anywhere from 20 to 25,000 vaccines a day per site. And we just touched on about 16,000 a day as we were getting our rhythm. And then just due to the vaccine shortages, we're down to, today we started shot 2. So we turned off shot 1 for basically 21 days unless the numbers go up. But we've been trending anywhere from the 5 to 7,000 for all 5 sites combined, just because of the total vaccines available. With that, I can tell you none are being wasted at the end of the day. There's a lot of different media things. We've got different algorithms to reach out to law enforcement partners, healthcare, et cetera. The limiting factor of our success and progress is vaccine totals. I wish I had a better answer. And the last thing I'll leave you with, I'm just the operations section chief running this machine, but I beat the trees every day on behalf of Palmdale and Lancaster and the Antelope Valley to get something going. But we're just robbing Peter to pay Paul to try and get these sites stood up. So any questions, I'm happy to answer.
Did anybody take into consideration that they set these things up to do 10, 20,000 people a day. Did anybody take into consideration what that does in regards to traffic fatalities? Did it take into consideration as to, once again, a severe impact on people that do not have the means to drive a car? I'm overwhelmed by just the inherent unfairness of having to tell people in Lancaster and Palmdale to drive to Santa Clarita. And no one even took into consideration, one, can they get there? How many people are going to have traffic fatalities on the way? The congestion when you do get there. I mean, it just seems to me to have been poorly thought out. And I understand you guys were told do 5 sites, so you do 5 sites. But I mean, when are we going to fix that? Because quite frankly, Chief, I think the Board of Supervisors have not exercised the best judgment in this situation, nor have very many others. I don't want to have a field hospital made of tents any longer than I have to.
Understood. I appreciate and respect that. The only thing I can tell you we didn't have the seat at the table on, if you will, where they were going and the overall deal. We were brought in to implement. I can tell you a small answer to that is we do have mechanisms at those sites in place for access vans, Uber, board and care facilities, shuttle vans, those things. We have implemented all of those things to make them as ADA accessible, but I fully understand and respect that piece. We do have a number of walk-up sites that are being folded under us, but they all come with challenges and they all come with different hurdles that we continue to overcome on a daily basis. I know that's not a good answer, but that's the best one I can give you.
No, I appreciate that, and I appreciate your efforts. I wish the Board of Supervisors had simply turned it over to the fire department, seeing as how you guys were the best trained to do this, and instead of making political decisions. But let's not cut anybody any slack here. Having a super site at Magic Mountain was a political decision. it wasn't a decision based on the health and welfare of the Antelope Valley. And I just wonder how many more weeks do we have to bear it? And while we're bearing it, Marvin, could you arrange for ABTA to set up some type of transportation system so that as long as we're forced to drive an hour to vaccinate our people, that we are able to transport the people who cannot drive themselves?
We've already set up those to Lancaster and Palmdale. We were told that we were going to have that site, but I'm being told now that even the Magic Mountain site has either been suspended or shut down. Is that true, Donna?
I could speak to that. Or I'm sorry, Donna. So a couple things on that. Number one, if you can get the people there with an appointment, then they would be accepted through there with that valid appointment. But with that, I think the gap, Marvin, is it has not been shut down. There's no intent on shutting it down. But we turned, I say we, at the direction of our bosses, if you will, we turned off the shot 1 yesterday, and we just did 21 days of shot 1, and now we're into 21 days of shot 2, with the ability to ramp that up. If there is a significant push of additional vaccines, we could fold both a 1 and 2 shot model into it. But right now, the vaccine availability isn't there. Sorry, Donna, I didn't mean to step on you on that one.
So my question is, you say that you didn't have a seat at the table. Who did make these decisions?
I'll let Donna speak to
Who made the decisions on the mega sites?
Yes, Dr. Trong just showed us that Santa Clarita isn't suffering. They're at 50% what we are. So wouldn't it be prudent to have a super site here?
Absolutely.
Based upon the numbers? So I'm just asking who is making those decisions so we can go to those people to show
Well,
them.
I think it's right. I understand what you're saying. It's been shared to me that it's based on population, for one. The decisions are being made by public health and the Board of Supervisors.
And they can't do math.
Yeah. Yeah.
Disappointed at best with
I agree.
the results. I mean, especially we're seeing numbers that they're 50% lower. Their death rate is 50% lower. So I don't understand the decisions being made.
Yeah, also too, if they're using statistics, they're lying to the public about their concerns for either poverty level people or even, for that matter, ethnic groups. They're not, I mean, we just saw the statistics countywide. So one would think that's where they would go, right? Or no?
Donna,
I agree with you.
Donna, this is really easy.
Yeah.
If they want to be the leaders of this county, at least do it with transparency. If you want rich people to live longer than poor people, say we want to protect the rich people more than the poor people, rather than saying somebody else is doing this to us. Because where they have placed those inoculation centers, there isn't any question in the people's mind what they're doing. I mean,
Right.
it's absolutely abhorrent that they won't even take responsibility for it. Say, these people who live here, these are the people we want to live. The people who live here, those are the people we really don't care if they live. Because that really is what they're saying. It is astonishing to me that they get away with this. And where the hell are the drug companies? Why aren't we hearing from them as to why there's this delay in the manufacturing of these vaccines? because what we were told is they had 100 million of them ready to go before they ever were approved. I mean, you know, it cannot be this level of incompetence. I mean, that scares me more than the plague. It really does. If our leadership is that incompetent, we are doomed. But I don't think they're incompetent. I think they're just malicious. And it is malicious when you say you're doing it for one reason and everybody knows you're doing it for another. But, you know, we don't get to tell them.
I agree.
And so do the hundreds of people that died needlessly in the city of Lancaster. Anybody got any cheery stuff to say? All right, now, Donna, it's your turn to cheer us up.
Well, okay. Today wasn't the good day for me to come to the table with anything good. I said it was a full moon day. Yeah.
I have some good news.
Go ahead, Tiffany. Sorry.
The test site at Jethawks is doing really well. We're getting a lot of folks through there and tested. The numbers did drop a little bit last week as far as how many people were coming to be tested. They've gone back up this week. The numbers of positive cases had also dropped last week. And while I don't have the specifics for you, I can tell you that already this week the numbers have increased. So that's just something to be aware of.
I blame Jason for that because he wouldn't black out the Super Bowl.
Well, so
I didn't black it out in my house.
No, that wouldn't be the Super Bowl, would it? That was Sunday. So how many days would we have to wait to see if the Super Bowl causes a surge?
as early as the end of the week, as long as 2 weeks, maybe 3.
5 to 14 days is the average incubation.
Do we have any way of knowing how well people complied with not having Super Bowl parties?
We've researched the use of cell phones to track, and that's been limited. We can use it for studies, but we can't limit it to specific to location, like addresses and things like that. But no, we did not track that. I'm sure there were many Super Bowl parties that were being held.
Are we working with Samaritan's Purse to hold on to the field hospital?
They are.
We've been go ahead, Dr. Stock.
No, we've urged them to stay at least another 30 days. We wanted to see the effect of Super Bowl and see if there'd be a Super Bowl surge or not. The numbers are down a bit, so we're working on them to see if they can take new categories of patients beyond the levels that they've been taking right now. So it's unfortunate because I think we're in a false sort of lull at the moment, and I think there's quite a few indicators that we're going to have future surges coming up, especially if we don't vaccinate fast enough, which has been the main theme here that you all been discussing. We're in a race right now, and if we don't get vaccinated fast enough, we're going to see a huge surge once the UK variant is the dominant strain, which is going to be in about a month from now. It's and it's hard because we are having a lull at the hospital right at the moment, as is everyone else. But it's because our numbers were so high before, we've come off the top.
Okay, are we still doing maximum enforcement on the masks?
Yes, nothing has changed on that. And then when we do receive complaints about certain stores, we'll send out code enforcement to make sure that it gets enforced.
It sounds like we're doing everything that I can't think of anything that we've missed. Can you, Larry, Jonathan?
One thing, we're doing a couple other things. We are actually going to be having our COVID rescue clinic on March 6th. We have volunteer physicians and nurses who are bilingual, who are going to come out. We're trying to really, we're going to be marketing to parts of town, hopefully to get people who are uninsured and unconnected with a healthcare provider right now, so we can both do a health screening, to do some education, provide information about a vaccine and how to prevent getting they and their family and their household infected. So we want to hit those pockets. We can see from the slide, it's young people that are getting it and old people that are dying from it. And we need to be smart about who we target for education and who we target for vaccination.
Wouldn't it be smarter to just drop the tier by age, at 65, 60, 55, 50, given the mortality rate?
Yeah, pretty much tracks it.
But we're not allowed to make those decisions for ourselves, are we?
No.
We have to rely on who's making these decisions, Donna?
The governor was looking at changing the tiers to age. I haven't been updated on that recently, but I haven't seen that happen. But that's what I was understanding, that he was looking at possibly doing that.
Yeah, it's my understanding the governor is the one who sets the tiers.
So we somehow slid into a monarchy without knowing it.
Right, he sets the tiers. We comply.
I have one more question. Rex, if you remember, we just not too recently talked with the school board and different superintendents. Donna, is there any talk on the teachers and when they're going to get, because we're still hearing parents, at least I've gotten a couple of emails about when schools will open up. And I guess it's a twofold question. I know churches are starting to kind of test the waters, opening it up stronger too. So Tiffany, I wanted to know, had you got any phone calls from churches? I myself got a little nervous because I did have a capacity of about 50 people and not many were showing up 10, 20, but the Super Bowl Sunday, we had the max that we could have show up, and it showed me how I even panicked a little bit. Like, wait a minute, where did you guys all come from? And we were spraying down and trying to do everything. So I'm wondering what schools and churches are you guys?
I haven't, no. For a while, we were getting a lot of calls and inquiries from churches. I haven't had any recently, no. Mm-mm.
What about the teachers?
I stay pretty close, and not teachers direct, superintendents. We communicate with the superintendents regularly, but no, I haven't.
Let me rephrase the question. I think I'm asking it wrong. Are the teachers going to be in that group priority along with the sheriffs and different ones so that we can get the schools back open? Is that being considered or no?
For vaccinations, is that what you're meaning? Okay. Yes. I'll check on that, Daryl. I'll get that confirmed and I'll get back to you on that.
I have been in touch with public health, and they are very keen on trying to get the schools open in our area and are interested in getting the school districts employees vaccinated.
Right.
I believe that is on the radar, Daryl.
Right. But I don't know the current status, but I'll check for sure.
Thank you, Donna.
Regarding just Daryl, none of the pastors that I am in touch with routinely reached out this past week. However, with the ruling on Friday, I know a lot of them were planning on meeting inside. We'll be meeting again the first of the month, the first Monday of the month. And so it'll be interesting to see how they've been doing with everything.
I'm curious because, and again, I'm a pastor myself, so many people know that, but we do know one of the largest days in Christendom is coming up in less than 30 days or about 40 days. You have Good Friday, end of March, and then Easter is that first Sunday, I believe. So and then we have Valentine's Day. We have a lot of things coming up that can really set at least our city back. And so we want to, Rex, we want to stay on top of it. If we're not getting vaccines, I'm just, I want to make sure that we're continually educating everyone that while our numbers may start to look good, we don't get lax and fall back into, a crisis again, at least in Antelope Valley, since we have to look out for ourselves, seem like. So.
Jason, I think we ought to go to the expense of seeing if there's any devices out there that can exchange air and run it through a UVC light so it kills any viruses, and see if it's feasible, one, and two, what would be the expense of equipping these churches with it. I think Daryl's right. There's no way, unless we want to see a surge in May and June, we have to take some technological preventative measures. The court has made it clear they can open, and I don't know how they're going to be able to socially distance on Easter. They're just not going to be able to. So let's see if there's a technology. There
is technology like that. We use it in the hospital. We in between operating rooms. So when a case is completed, they would go and clean the room, and then they would put the UV light, which sweeps the entire room and kills microbes. And it takes 35 to 40 minutes per treatment. So we do that in between our ORs.
Yeah, I'm familiar with that, Dr. Trong, but what I'm thinking about now is they're putting that UV light in the ventilation system itself. But some of these churches are pretty old, and they're not going to have the capacity to exchange the air quick enough for it to make an appreciable difference. But I think we should get people working on that. What can we do to minimize the surge after Easter? That's the assignment. You know, is there's something out there? And let's turn it over to our friends at NASA again. I mean, they've invented some crazy stuff that really works. But if we could get them working on it now and then locate where we buy it, then I suggest we do it. Any thoughts, you guys?
We'll look at it.
There is already a system like that, and also used in the hospitals. What we do is we exchange the air 6 times per hour, and that air goes through a UV light system to kill microbes. We use it for tuberculosis prevention. So a patient is in the room, and that air is exchanged, and it goes through the UV light to kill the microbes. It's out there. It's expensive, but it's doable.
But let's see what we can do. I think
it'll be important, Rex, because most of us will have more services than we normally do to fit, to make sure that we stay in compliance. And normally I have one huge, so you've been to my Easter service. Did you know how packed that 10,000 square foot building I got is? Imagine the rest.
I know. I had to go get new hearing aids.
So we'll probably have 4 or 5 if people are willing to come out, and people are, they can't wait to come back to their churches. So we just want to see what can we, since we're such a friendly place to churches, we want to see what we can do to kind of help that area.
Daryl.
Yes.
Daryl, I did get an answer to my question. Teachers are still in the same tier as law enforcement.
Okay.
Yeah, and food service.
Okay.
But even if we moved them up, there's not enough doses at this point. Only 20% of 65 plus have been vaccinated so far.
Okay.
Mayor, if I could ask Donna a question here. I have a question for the county supervisors. So UCLA did a study showing where there should be targeted priority for vaccination based on medical vulnerability index. And the 2 areas of the county that have the highest index seem to be South Central County, where there's really high numbers, and also the Antelope Valley from the East San Fernando Valley up to Lancaster and Palmdale. So I'm just wondering if there was no pod put up here, despite the fact that we have a very large medical vulnerability index, what the supervisors were thinking to put it in Newhall, where there's actually a really low index of medical vulnerability.
Right.
So I really think we need an answer from the county supervisors, and not only, I think we have time still to reverse course and vaccinate. In fact, their own every couple of year public health data indicators show that we are in the most challenged spot for many of the top indicators: diabetes, obesity, hypertension, unemployment, smoking, all that stuff.
Right.
So
Barry, this is where the county sends their poor people to die. We all know it. Let's say it the way it is. You know it. if they talk you into moving to Lancaster and you have any type of chronic disease, you will die 5 to 10 years earlier. Those are their own numbers. And now we have COVID and they're withholding the vaccine from us. You know,
I would ask that based on there's pretty hard data here that we ought to be prioritized, not just given an equal share of the vaccine. Yeah. Okay. And in fact, we should make it, as we talked about earlier, we probably, given the unemployment rate here, we have an even harder time accessing, far distances where the people of Santa Clarita could have driven up, because most of them have cars down there and money for fuel. So I'm just wondering what the rationale was and if we can reverse course at this point to prioritize our area.
I gotcha.
Good, thank you.
I'll follow up with you, Larry, offline. Yeah.
Thank you.
Yeah.
And you know what really makes me more angry is the Board of Supervisors, 4 to 5 are Democrats. And the Democrats are the ones always pushing out how concerned they are for the regular people. And it's just a lie. It's just an unmitigated lie. All right, let's move on. I was gonna be happy today.
Really quick, for the church, I just want to remind everyone that's listening, that's on this meeting, that there is still a limit of 25% occupancy. They took off the hard number of 25% capacity or 100, whichever is fewer, but it is still 25% capacity. And as I understood it, at least as of Friday, singing, chanting, and group response was still not being allowed. So that's just something we need to keep in mind. If we follow those things, it will help. It's not going to solve the problem, but it will help.
Tiffany, I'm wondering if we could work something with the churches who want to work with us to get the choir tested, because the likelihood of the choir not singing is remote. Can we start talking to them about that now? Maybe get people tested on Friday, have results on Saturday?
Sure, we can do that.
Daryl, could you help her with that?
I sure will.
I mean, we ought to at least get all of the people that are facing the audience tested. Maybe that'll slow it down. Does that make sense, Tiffany?
I think so. I think that's a better option than not doing anything, especially because your choir, your pastoral staff, your worship leaders of sorts are the ones that are also most likely to come out, reach out, greet folks after service and before service. So I definitely, that is a point of contact that could potentially increase numbers dramatically. And if we have people tested, then that will potentially decrease numbers.
I just think we ought to recognize people are going to do certain things, so let's work with them and what we know they're going to do. Let's get out of this fantasy mode of thinking people are going to follow the governor's orders. All right, thanks. So Larry, before we move on, tell me a little bit about this health fair we're doing.
So the date we've chosen is March 6th. I think our plan is to run it from 9 in the morning till 3 in the afternoon. The marketing is going to be to try and target those people who are uninsured in our community. We have volunteer providers, doctors, PAs, and Ps, as well as nurses that Maria has recruited who are bilingual. And I think our goal would be to have a drive-through type thing, probably at the fairgrounds, I believe is where we've sourced our area, and have people drive through to do a brief health screening for signs and symptoms of COVID using pulse ox and physical exam and history taking, and then to give those people, based on those findings, a certain package of information. That information, if they're really sick, is to get them to the hospital, but barring that, information about isolation and quarantine, information about public health things they can do to protect themselves and their family, such as distancing, avoiding crowds, masking, hand washing, and outdoors rather than indoors. And then lastly, about vaccination. And hopefully, I'm hoping by the time we do this, we have some solid information about how to get people vaccinated. That would be the big payoff, and encourage people to get vaccinated. So that's the take home.
If we don't have enough COVID vaccines by then, are we going to consider other vaccinations? You got shingles, you got pneumonia, this population has probably not been vaccinated.
I think the goal of the thing is to provide information. So we certainly could redirect people towards other things that are really, high benefit vaccines, such as flu vaccine and other health measures. I think in this particular population, I'd be happy to, talk to people, give them information about how to avoid hypertension, how to avoid, how to, diet and exercise and stuff like that as well. So I think there's a lot of potential. And we're thinking of it as a COVID-focused health fair. But really the goal is to drive down the risk of transmission.
Yeah, and that's true, Doc. This is Maria. Dr. Stock, you're so right. I mean, especially I think LA Times came out with regarding the COVID deaths among the Latino Hispanic community, highest. And you saw the data from Dr. Trong. And in our communities, we're seeing that it's just, due to the fact that many are losing housing. And some of them are doubling up in housing, two to three families. So in that case, that's when the education and prevention comes in place. How do you teach someone that is living with two or three families on preventing transmission of COVID? And where do you access services? So I think what Dr. Stock is doing is very important, especially among the Latino Hispanic communities, because even in the hospitals, the death rate is mainly among those that are, over 80, and they have no family there to see them die. And so I think this is a great way to educate our communities.
Well, Maria, shouldn't those 80-year-olds have driven down to Magic Mountain and got see what I'm saying? I mean,
no, I understand. It's just that there is accessibility and availability of the vaccine is lacking in our community. And I don't know how else it's to advocate to our, our supervisors of the need. I mean, this has been going on for many years. And just the fact that I just don't understand, we see that Palmdale has a lot of mortality rates and cases, but yet their ICU is much lower than AV Hospital.
Yeah.
So
I totally agree with you, Maria. This medical vulnerability index is being used by the governor as part of his color-coded index about when we can safely reopen again. So why is it not also being, prioritized as an element of deciding where to put the vaccine? I would say it's pretty straightforward.
Larry, what is the name of that index again?
Marvin, I'll send it to you. It's a medical vulnerability index. I'll email you right now.
Yeah, when I was looking at this morning, I noticed that children not only are they not dying and are they not getting really sick, but they're also not getting sick. I mean, the percentage of children that catch this is really low. Has there been any, is that consistent with what you know?
Yeah, children just don't get this infection. It's the opposite in terms of influenza. Influenza, the adults get them and they don't get very sick. But children, when they get influenza, they just get wiped out, and then it's reversed for the COVID-19. There's suspicion that as you get older, you get exposed to more COVID infections. So you generate antibodies against COVID infections. So when you get this strain that's deleterious, your body goes into a storm. Kids don't get the cytokine storm like adults do. And so that is a suspicion. We see with other infections as well. We see with dengue fever, with yellow fever, with malaria. The more times you've been exposed to an infection, it's a second or third time. That's when you really get into a lot of trouble. Corona's been around us for years. There's at least 8 strains before this. I'm sorry, 6 strains before this Wuhan strain came about, and now the English and the South African and the Brazilian variants. So yes, children don't get sick; they're fine.
Oh, why don't we open the schools?
That's amazing.
What am I missing here?
But maybe it's not the schools. Maybe it's the teachers who don't want to go back. The teachers are afraid. They become they get infected too. So
that's why they should be the first ones vaccinated.
Correct. Yeah. By the way, I'd like to say a few words regarding availability of vaccine. I have many physicians that I know and staff volunteer at the Magic Mountain site on the weekends. So they go there and they spend the whole day there vaccinating. And by around 3 o'clock every Sunday, there's about 500 or 600 doses that are available because people schedule appointments and they don't show, or they schedule appointments at multiple sites just to be strategic. And then they basically, so these 500 to 600 doses are available. And I would get a text from them, from the doctor, and say, hey, do you know anybody who needs it? Do you want to send your grandma or your grandpa to the site so we could give it? So there's a lot of availability. I don't know what to do with that. It's do we put people on the bus and get them there or something like that? I don't know, but it's a lot out there.
Thank you, Dr. Trong. Marvin?
I have a question for Donna. Donna, can you cross county lines to get the vaccine?
That's an interesting question.
Well, my question is,
go ahead.
I know for a fact that people in Ventura County does not have any super sites. Okay, and a lot of the people in Ventura County are getting vaccinated in LA County. And if that's true and we can cross county lines, why can't we partner with Kern County and vaccinate Mojave, Roseman, Tehachapi, all that, and Roseman and Palmdale, and have a super site here?
Marvin, I can answer that a little bit. Fire department. So 2 things. To touch on Dr. Trong's point, at the end of the day, the vaccines that are extra, if you will, are still frozen. They're not being wasted. They're being returned to the pharmacy to fill appointments for the next day. Marvin, with regards to your crossing county lines, and I'm not sitting here saying I agree with it. It's actually been a huge sticking point with us. But even if somebody makes it through the appointment portal, their zip code gets checked. And right now, public health stance is if you are not an LA County resident, you will not be vaccinated in LA County. So we've been turning a lot of people away at some of these sites. It's been very, very painful, but that's the public health stance right now. LA County resident gets a vaccine in LA County, no other county.
And it was my understanding that they need to show proof of 2 forms of ID, correct?
Depending on the tier, whether it's a healthcare worker, so you need to show your credentials and a form of ID. They're not really holding to there's a little bit of leader's intent and some common sense that goes along with that, but we are getting, for what it's worth, there's people that are coming from out of LA County to come get an appointment, and in good faith, they tried to get an appointment. They got one through the portal, however they got it, and they're doing it right. But we have also seen a massive amount of gaming of the system. People selling their appointments, selling their QR codes.
Wow.
So it really is a tough nut to crack, and dissecting between a mom that's there because she has an extremely sick child, and then seeing other people with the same form that mom had because that form has been sold or disseminated. It's really a tough decision-making algorithm when you got to look these people in the eye. But out of county, long answer, out of LA County is not being vaccinated in LA County as best we can through the screening process.
Right. I mean, the portal is pretty thorough in screening.
It is.
I've been through it. I've been trying to get an appointment for my mom. She's over 75. So, and I have not been successful. But I mean, I think it's pretty thorough in screening eligibility.
It is. But I will tell you, with each day, we turn over a new rock of like, okay, we got to update the portal with this, and we got to update it with that. So there's been some challenges with it.
Yeah.
So, and believe me, the boots on the ground people would really like to be at the point. You show up with an appointment, you get a shot, but we're just not there, or we get sideswiped by that methodology.
Right.
Chief, thank you. Thank you. I mean, thank you for your department doing this, for having to, I mean, I could not imagine your frustrations. I wish they would just turn it over to you and give you the mission. I think you would accomplish the mission.
Appreciate that. Thanks.
Thank you. Okay, let's move on. Anybody else got anything else? Anything else we can do?
We need to ask for public comment, Mr. Mayor.
Oh, okay.
At the time, anyone wishing to comment on ED1, please press *9. I will announce the last 4 digits of your calling number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please press *9 at this time if you wish to comment on ED1. Marcos Alvarez.
Hi, thank you for allowing me to speak. My question is to Jonathan, Mr. Trong, Dr. Trong, and you mentioned that the pattern is because people make appointments to get them, so you use the latter part of those afternoons. You have multiple vaccines left, right? Is there an expiration date also as a factor as when they can use those are already left for this area?
Usually when you thaw the vaccine, the Pfizer vaccine, you have 5 days and to use it. Otherwise, it's ineffective. For the Moderna, it's a little bit longer. I think Moderna was 30 days. Chief, you can clarify for me, but that's what the literature tells us.
I guess a better way. So the vaccines come frozen, okay, and we only thaw to keep up with the pace of the appointments arriving. So at the end of the day, and sorry, I'm looking for a pager. So at the end of the day, the stuff that is still frozen still has a very, very lengthy expiration date. The only extras we have, and it's usually anywhere from 30 to 40. I can tell you, so as of yesterday, we're just under 183,000 vaccines given at those 5 sites. And I know of 2 vaccines that were in a syringe that were wasted. That's it. Everything either remains in temperature and is returned to the pharmacy, or the stuff that is out of temperature, we will reach out to local law enforcement. It's not phone a friend, it's local law enforcement. It's people that are landing in appropriate tiers. But the expiration date really doesn't affect how our day looks, if that answers your question.
Thank you to both of you for answering that. I was trying to understand the lifespan of when it begins to be thawed and to when it's waiting to be administered to anyone. Thank you again.
Dave Bowman, you may speak now. Unmute yourself.
Thank you very much for allowing me to address the council. Mr. Mayor, time and time again, the people of Lancaster have gone ahead and voted you into office because of your high level of leadership. Now, perhaps maybe is a good time to put an appeal out to the people to see how we can aid you to apply more pressure to the supervisor's office in order to obtain more vaccine for a population that is like massively affected. We've got more retired people here. We've got more blacks. We've got more browns here than just about any place else in the county. So please tell us, is there anything that we can do to go ahead and help your effort? Thank you very much.
You know, the more vocal people are, meaning call the Board of Supervisors, call all 5 of them, you know, the more you post on social media, the more you send letters, you know, all of that stuff has an effect. I know it has an effect on me. I know nobody believes that, but it does. You know, you can't help but be, you know, I don't need to say it. I don't need to articulate it. What I do need to hear from people, though, is, listen, this is not fair. They really are cheating. There is a reason the death count is the way it is. It's, I mean, the numbers don't lie, nor do the graves, nor do the body bags. You know, Woodland Hills doesn't have any refrigerated trucks to store the bodies. We have 2 of them at AV Hospital. What is happening is so deplorable that it defies description. And it's not adequate for people who take on the roles of leadership to take on the connection to the drug companies, to the pharmaceuticals, to have no explanation as to why we are having to endure this. It is a total disregard for their responsibilities to the community. And if the community doesn't rise up and raise hell about it, our people will continue to die at a disproportionate rate. It's that simple. You know, if you listen to what they say and apply it, we should be first with the vaccine. Because that's what they're telling people. We're going to take care of the people who are the most impacted, which are the Latino and Black population. That defines more than 60% of our population. So why is the vaccination center in Santa Clarita? You know, what they say and what they do are diametrically opposed. And if you know, if it's our families that have to, that end up in Samaritan's Purse tent, dying with strangers, and that's what happens. Is, you know, all these people who've died, they didn't get to die with their family. They died alone, absolutely alone. It was the nurses that held their hand, but these nurses didn't really have time to hold their hands because so many people were dying. You know, we need better answers. You should at least know why this is happening to us. And so far, we've gotten no good explanation. Nor do, you know, we just get promises that are not kept.
If I can make a closing comment, sir.
Sure, of course.
This is directed to the supervisor's office. Mr. Mayor, I'm actually offended at the way you went ahead and you responded to the first 2 questions that were directed to you by the city council. I don't think anything is funny about what's going on and happening here in the Antelope Valley. I don't think any of the city council think that your remarks were funny or entertaining. Please, ma'am, if you have any influence with the supervisor at all, I would request that you go ahead and try and do something about this, because everybody here in Lancaster is concerned, and the mayor is right. People are dying here, and we have to have the vaccine here. Thank you very much. I appreciate being heard.
Caller with the last 3747. I'm sorry. Caller with the last 3747. Please press *6 to unmute yourself.
Hello. This is Cynthia Carter with the ACLU, and I was calling in to speak about the administrative citation.
Okay, we are not on that item.
Here. Okay, there are no other callers for ED1.
Thank you.
Mr. Mayor, if I can say something in defense of Donna, Mr. Bowman, you're right. It's not funny, but Donna handles a lot of people yelling at her very well. She does a good job. She does it very well for our community, and it almost gets to the point where you are close to crying because of the need of the community. So I think that was a defensive reaction to the urgency of what we're asking her. And by no means it's disrespectful. So I just wanted to stick up and say thank you to Donna and thank you to the supervisor's office.
And I agree with that, Donna. You have an impossible task. Okay.
There's no way I feel this is funny. I'm not exactly sure what he's referring to, but I deal with this 24/7. Our staff deals with it every day. Most government offices are closed. We're there every day taking calls and fielding and helping people with appointments. And by no means do we not take this seriously. I don't know what else to say.
You're good, Donna. I think I actually think it was me that, when I realize I'm getting angry, I try to be a little funny with it, and sometimes that's misinterpreted. But this, patient zero was January 20th. That is a long time for us to have to live with this rage. Okay, so that's it for the public comment on that. Let's move to the
Consent
calendar. Anything to be removed?
No, sir.
I think we need to vote on ED1, don't we? We have 4 items.
Those 4 items were there in case there was an action item needed. Jason, I don't believe we have an action item tonight.
No, we don't have an action item, just a report.
Okay, so we're just going to receive and file?
Receive and file the report from the various deputy mayors, from the representative of the supervisor's office, et cetera. Yes, thank you.
Motion to accept the consent calendar as currently comprised.
I'll second that motion. Mann.
Let's call the roll.
We do need to take comments on the consent calendar.
Oh, that's right.
At this time, anyone wishing to comment on any item on the consent calendar, please press *9. I will announce the last 4 digits of your call-in number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please press *9 at this time if you wish to comment on any item on the consent calendar. Dave Bowman, you may unmute yourself and speak now.
I would request that the city council or their clerk go ahead and read off the items on this list, please. Thank you.
Mr. Bowman, why don't you come back on? Is there a reason for that? Is that not on the website?
With all due respect, sir, there are a lot of people probably that haven't been to the website, and all I'm going and asking for is a small concession.
I don't have an objection. City clerk, go ahead and read it.
Okay. CC1 is to waive further reading of any proposed ordinances. This permits reading the title only in lieu of reciting the entire text. Item number CC2 is approve the check register and wire registers for January 10th, 2021 through January 23rd, 2021 in the amount of $8,391,776.26 as presented. Item number CC3 is to approve an agreement with Masons at 40th, the developer of track number 62578, to provide needed right-of-way for required street improvements for the track through condemnation proceedings. And the last item is item number CC4, which is award bid to United Sports Surfacing of America to fulfill Cal Recycle's tire-derived grant received for Wick Carter Park. So at this time, if anyone wants to comment on any one of those items, call it with the last 4912. Please press *6 to unmute yourself, and you may begin.
My apologies. This is Ruth Sanchez. Is not one of the items that I wish to speak up on.
Okay. Caller with the last 43747. Please press *6 to unmute yourself.
I apologize. This is not the proper time. I'll stay online.
No other callers at this time.
Okay, call the roll, please.
City Council Member, Agency Director, Authority Member Doris.
Aye.
Molly.
Yes.
Mann.
Yes.
Vice Mayor Chris.
Yes.
Molly.
Yes. I don't even.
Oh, I thought I skipped your name. Sorry. Mayor Paris.
Yes. Passes unanimously. Moving on. We're now going to go into executive session. Allison Burns will say the magic words to allow us to do that. We're going to consider the amendment to the Lancaster Municipal Code in consideration of the ACLU's latest endeavors to subvert the criminal justice system. And then we'll be back.
So at this time, the City Council will be entering closed session for closed session item numbers 1 through 20 as stated on the agenda.
Okay, we are back in session. The public hearing is now open.
Wait, Mr. Mayor, may I make my announcement, please?
Oh, sure.
Thank you. In closed session, the City Council took up agenda item number 1 and gave direction to staff and legal counsel. No reportable action. Thank you, Mr. Mayor. We're now ready for public hearing.
Okay, and we don't tell them all that secret stuff we talked about?
We do not discuss matters discussed in closed session and open session. Thank you.
You know, that's how you end up with COVID vaccination centers at Magic Mountain, is when you lose transparency like that. But that being said, the public hearing is now open. We will hear the staff report regarding PH1 from Lita Rico, Public Safety Director.
I think Jocelyn's doing it, isn't she?
Thank you. Yes, I'll start and then Lee can chime in if you have questions. Good evening, Mayor. Good evening, Vice Mayor. Good evening, council members. It's nice to see you. It's been a long time. You'll recall that in November of 2014, Proposition 47 was approved by the California voters. Prop 47 amended the California Penal Code so that certain nonviolent criminal offenses must be charged as misdemeanors, for which offenders are subject to imprisonment in county jail rather than state prison. In February of 2015, the City Council considered and discussed their concerns about the potential unintended consequences of Prop 47. The primary concern was that some persons would be emboldened to repeatedly commit these crimes, and local businesses would be particularly at risk of suffering significant financial losses through repeated recurring incidents of shoplifting and burglary. After consideration and discussion, the City Council adopted Ordinance Number 1001, which added Chapter 9.48 to the Lancaster Municipal Code, establishing as an alternative to pursuing misdemeanor criminal proceedings, administrative penalties intended to dissuade persons from committing certain enumerated offenses in the City of Lancaster. The administrative program has been a success, resulting in persons being held accountable for unlawful activity while allowing them the ability to avoid criminal prosecution and possible conviction on their record. Now, recent additional changes to state laws and other steps in reforming the criminal justice system have been and are being implemented at the state and county levels, including a focus on diverting persons charged with misdemeanor offenses away from criminal proceedings altogether. Thus, a wide range of misdemeanor offenses, in addition to those currently enumerated in Chapter 9.48, are not likely to be addressed through the courts. Staff believes that it continues to be in the public interest that persons who commit misdemeanor offenses be held accountable for their crimes. Therefore, staff recommends that the City Council adopt this ordinance, which will expand on the existing administrative citation program to include all misdemeanor offenses that do not involve violence or physical injury, which will benefit public health, safety, and welfare while providing persons who commit such offenses an opportunity to avoid criminal proceeding and possible conviction. Staff also recommends that Chapter 9.48 and other chapters in the municipal code that authorize the issuance of administrative citations should be amended to supplement the existing due process procedures already set forth in those chapters. Specifically, we recommend codifying a procedure for initial review of citations prior to a cited person having to pay the penalty amount in order to have an administrative hearing before a hearing officer. We also recommend allowing a cited person to request a review of his or her ability to pay the citation amount in full, and where that person is unable to authorize monthly installment payments. And further, to provide a cited person with the option of performing community service in lieu of paying the penalty associated with the city's administrative citation programs. These are informal procedures that staff already utilizes, but we believe it's appropriate to codify these processes. I'm available for any questions.
Any questions?
Motion to approve.
Wait a minute. Before we do that, Marvin, I have a question. My motivation for this was primarily to keep people out of the criminal justice system, to keep them from getting criminal records so that, they could get jobs, so they could, they don't have to carry the weight of this. Isn't that why we did this?
That is a large majority reason why we did this. Yes, absolutely.
Okay. All right, Marvin.
Motion to approve PH1 by introducing ordinance 1079.
I will second that motion.
Okay, let's open it to public comment.
I believe you declared the hearing open previously, Mr. Mayor, but if you did not, please do so.
If I did not, it's now open.
Thank you.
Okay.
At this time, anyone, I'm sorry.
No, I was just suggesting you call whoever wants to speak.
Okay. At this time, anyone wishing to comment on PH1, please press star 9. I will announce the last 4 digits of your call-in number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please press star 9 at this time if you wish to comment on PH1. Dave Bowman, you may unmute yourself and begin.
Thank you, and I appreciate the opportunity to be heard. Mr. Mayor, as you well know and that you alluded to earlier in the evening, this action by the City Council has caused the American Civil Liberties Union to go ahead and act again for the second time in like 7 years. And I'm starting to wonder if maybe financial consideration should be given to what is happening in relation to this ordinance. I mean, for the second time, you know, financially, we're being threatened again. And not only that, the Sheriff's Department is also being threatened now. I don't know how many of you are going to go ahead and answer this question, but I'm sitting here and I'm wondering if you folks have actually gone ahead and read the text of the ACLU action at law, because I have, and I found that it has pretty solid foundation. And what I'm really concerned with is that what is going on here is going to go ahead and cost taxpayers as well, too, a second time. And it's so easy to go ahead and remedy this pursuant to their own motion at law. And I would beg that the council go ahead and consider what it is the ACLU is wanting as far as remedy is concerned. And this thing that's going on with the cops, I mean, maybe it's time that the city council go ahead and consider possibly establishing a citywide police force rather than being dependent upon Los Angeles County Sheriff's Department. I mean, you know, we already go ahead and spend a significant amount as far as the budget is concerned here in the city of Lancaster. We've just recently gone ahead and passed a new tax ordinance that could go ahead and help us as far as the shortcomings of that fund is concerned. And the reality is that the Sheriff's Department all the way up and down the state here in Los Angeles is being known literally for being out of control. And I would beg the council to go ahead and consider relieving the Sheriff's Department of their duties here in Lancaster and hopefully establishing our own PD. Thank you very much for the time, sir. Appreciate it.
Caller with the last 4 digits, 3747. Please unmute yourself by pressing star 6.
Hello. Hi, my name is Cynthia Carter, and I'm a 30-year tax-paying resident of Lancaster, California. I'm a member of ACLU here, and this ordinance is malicious financial war on poverty, on poor people. I'm also an advocate and a caregiver for a developmentally disabled community, and they average $940 a month, $500 excessive fee for these crimes, and it would put them in. I'm going to give you just a quick example of one client. He's fanatical about paying his bills, and he pays every bill he got on time, in full, with nothing left over. With the help of food banks, he's able to make it through the month. If he were to be fined this $500 and being unable to appeal it before he pays it, unable to have community service because he cares for an elder person, this would be devastating. This is a punishment. This is you said you took it away from the criminal justice to make it's financial crime against the poor. He would be unable to pay the $500 without having to decide to pay rent or pay utilities. And I'm just thinking of his example because he's a very upstanding guy. He's a big guy, looks old tattoos, and he stopped frequently for quality of life. He stopped just because he looks as he looks. $500, he would not be able to pay that. And he would be in a position of, one, it would add on to his, plus, if he couldn't pay it the $150, then it would add on to his credit rating, which through hard work he has bought up because he's an upstanding citizen. This is This is, come on, this, to be clear, this is so reminiscent of Jim Crow laws of vagrancy and loitering that was able to keep blacks in servitude, financial and otherwise. This is an attempt to run the homeless and the poor and make this our beautiful city, Lancaster, to make this as inhospitable to them as humanly possible. This is excessive, this is unconstitutional, and this is actually just plain old malicious and cruel, especially at the time, this economic time. $500? That's devastating to someone on a fixed income for sitting on a bench or for doing these things. This is an attempt to run the poor off and to make this city not their city. And this particular one that I have in mind, he's a 40-year resident of this city. This would set him behind so far.
I'm sorry, ma'am. Your 3 minutes are up.
Thank you.
Caller with the last four. 4978. I'm sorry. Caller with the last four, 4978. Please press *6 to unmute yourself.
Good evening. My name is Javier Flores. I'm calling as a representative of Antelope Valley League of United Latin American Citizens. I'd like to make the following statement. Lancaster should be investing in people and community resources to make us safer instead of spending our tax money on counterproductive, complicated, and expensive systems of punishment like this one. Lancaster needs to stop criminalizing poverty. It makes no sense. It doesn't make our city safer for the people who are too poor to afford food and housing. This ordinance does too little. Lancaster needs to account for how it has violated people's constitutional rights and clear all the tickets and citations it has already illegally imposed. I'd like to ask a question. It sounded like the decision that you made was to change the way this law is implemented, and instead of charging people before they get a chance to appeal, allowing them to appeal first. Is this correct? Am I interpreting the change that you're proposing correctly, or did I get it wrong?
Allison, if you could answer that.
Of course. The proposed amendment would allow for an initial review of citations upon request by the cited person to determine whether the citation was properly issued or if there are extenuating circumstances warranting dismissal. And then thereafter, an appeal upon payment of penalty would be allowed. So the initial review does not require payment of the penalty, but the appeal, as always, would.
Thank you.
Caller with the last four, 4912. Please press *6 to unmute yourself. And you may begin.
Hi, my name is Ruth Sanchez, and I'm with the ACLU Antelope Valley chapter. Thank you for tonight. And my proposal to the mayor and city council is as follows. You had mentioned previously in the meetings, more so in the one in December a year ago, that the problem and the issue that you have is the fact that of the dumping and all the trash. I brought a solution and requested dumpsters so that we can do cleanup even with the unhouse. Neither Marvin or the mayor, neither one of you guys came through with those dumpsters. As well as what you guys are now proposing to do with these fines is ridiculous, as people don't even have money to purchase food. The county and both cities, the whole Antelope Valley, has really, let down all of our unhoused individuals. Not only that, but you need to remember we also have veterans that are out there in the trenches, and all we're doing is just keep pushing them into somebody else's hand, into the next county over. So you ask for solutions. How about all the illegal dumping that is out there? Why is it that you guys don't either, one, talk to Waste Management and tell them to reduce the fees for the trash service? Two, bring those trash dumpsters as I've requested, and I guarantee you we can clean up. It's free service. We're not charging you a penny, but it's not working. So if we're going to work together for a solution, let's actually do the work, not just come up with, you know, with this kind of atrocious and fines that you want to do. Most of those people, like I say, they don't have money. They get $210 on GR and maybe $110 on food stamps. How do you expect them to pay $500? And let's just go ahead and save the money. We know that even if they're going to go ahead and go through all the investigations to see if this is an adequate fee or not, it's going to come back that it is, because it's being done in-house. So again, I am completely against your proposed PH1 ordinance. Thank you.
Caller with the last four, 3333. Please press *6 to unmute yourself, and you may begin.
Good evening and thank you. Good evening and thank you. My name is Christina Patz, and I currently serve as a board member with the ACLU-AV. I am also currently a graduate of California State University Bakersfield Criminal Justice System. And as not only do I work with the unhoused in a volunteer capacity, but my current working position in social services, I have to deal daily with contact with our reentry program participants, and those are commonly members of our unhoused population. Requiring an individual to pay to have their case heard is hugely problematic and a violation of our California Constitution. Imposing a quality of life citation is essentially stating that one being homeless is a crime within our city. Is this how we wish to treat our most vulnerable in the direst of times? The fines imposed by this administrative citation program is not only an unconstitutional punishment, but a waste of necessary resources needed to help the community as a whole, which you, Mayor, so kindly prayed for in your opening. At this time, I ask that we lift up the most in need, but not make their unfortunate placement in this town be a crime, but let them be helped and be brought back to where they can be accountable and be able to be productive members of society instead of being pushed into the shadows. That is all. Thank you, and thank you for your time.
Fernando Nunez, you may unmute yourself and begin.
Hello, my name is Fernando Nunez, and I'm a resident of Lancaster for over 20 years. Most of my life, I went to college and then came back in late 2019. And since then, I've noticed that the city has engaged in what seems to be now a pattern of targeting the homeless population in Lancaster. Just last year, it was going on about passing an ordinance criminalizing feeding the homeless in public spaces, which didn't go well. And now I recently heard about this ordinance, and I can't help but see that the city is targeting this population. This is during a time when people are being evicted and becoming more homeless. So instead of focusing on keeping people housed, the city seems to be bent on targeting and driving out these people from our city. So I heard that the council reconsidered the appeals process. I don't think it's going far enough. I think the whole system needs to be removed, and any citations that were already issued need to be recalled and give the people their money back, because these collectors and everything that's a consequence of this is going to do a lot of harm, and especially right now when people are hurting financially. Thank you.
No other speakers at this time.
I'd like to speak. Hello?
Okay, please state your name.
My name is Ron Kagan, and I'm in the outreach director for the Antelope Valley chapter of the American Civil Liberties Union, and I also serve on the board of Southern California, ACLU. I wanted to bring up a couple of things. And first of all, I think it's ironic and it's sad that Mayor Paris seems to have animosity towards the ACLU, which is a group whose only mission is to uphold the Constitution of the United States of America, number one. Number two, let's get down to reality. According to the United States Federal Reserve Bank, today, 40% of Americans could not come up with $400 cash or credit for an emergency. Now, we're not talking about the folks that are now living out in the desert. We're talking about our friends and neighbors. And I know that probably each and every member sitting on the council knows somebody that's going through financial problem. We have friends and neighbors who have businesses that are doing poorly if they're even in business today. I think that reality is that the population that you are looking to fine, if they had the $500 to pay the fine, would stay at a sleazy motel for $69 until that $500 was used up instead of paying a fine. And I wonder what the cost of administering this program is going to be, because there is a cost to the city to administer this program. And I don't believe that the return is going to outweigh the cost of the program. Another thing is something that the mayor said earlier is that LA County and seems to send all of the bad folks up to the Antelope Valley. Well, what we have is a mayor that is now sending a lot of folks out of Lancaster into the desert. And I would invite Mayor Paris to go with us at any point in time and meet with those folks, because 99% of those people were residents of Lancaster who were cited and forced out into the desert. Many of those people live where there's obviously no water. The closest water is the fairgrounds, which is 4.5 miles away. Many of those people don't have transportation. So going back to COVID, we need to deal with that, which is a separate issue. So I think the reality is that this proposition that we're looking at, or the city is looking at, is ridiculous. And it's if you just think about it, it's dumb. And
Mr. Kagan, I'm sorry, but your 3 minutes are up.
Thank you very much for your time.
Thank you. Jason Jones, if you could, please unmute yourself and you may begin.
Yes, me and my husband are chairman and vice chairman of the ACLU for the LGBTQ board. We are thinking it's very wrong how the mayor people vote for the people. He's not for the people. He shouldn't be throwing people out of the community. The people needs him for his support. We voted for him because we wanted a change. He's not changing nothing. He's making the homeless look worse than they are. He doesn't care about nobody. It seems like all he wants to do is move them out of the county, which is sad. I'm an LGBTQ. I'm a gay male. I stand for a lot of gay and lesbian folks out here. When I sit there and say that most of the homeless out here are youth, they need support. They need our help. When we're there to help them, they're there to help us. If you guys cannot help us, then why did we vote for you guys? If you're not there for us, then you guys need to be off the board. Thank you.
At this time, if there is anyone else that wishes to comment on PH1, either raise your hand or press *9 at this time. Sylvia Garner, please unmute yourself.
Hi, my name is Sylvia Garner, and I am the life coach with Honorable Services Career Center. I have also spent 10 years as the youth pastor of Livingstone Cathedral of Worship for the youth department. And my heart is really just aching at the thought of what is going on. I am sitting here and realizing that veterans have the highest number of homelessness in Southern California, in California in general. And this is not the way that we treat our veterans. This is not the way that we treat our youth. We are tasked to work with our homeless and our unhoused. And I, along with Ruth, went to the meeting where we spoke with you, Mayor Paris, and we asked for the trash can. My husband and my adult sons have cleaned up for an hour after we have served the homeless. You said you didn't have a problem with what we did. And as this comes back around, now all of a sudden you're saying you want to charge people fines for citations when people are barely making it today. And this is not who we should be. This is not who we are. And my heart also aches because I remember having a conversation with you before when I was working with the NAACP, and you made a comment that you were focused on bringing Asian Americans into the Lancaster community. Now, I don't have a problem with you cleaning up your community, but I nor anybody I know will stand by and allow you to do this to people while they are at their lowest and poorest time in the middle of a pandemic. How dare you? How dare you take the last bit of dignity that these people have and fine them and charge them and cite them? God will be your judge. I'm done.
Caller with the last four, 5251. Please press *6 to unmute yourself, and you may begin. Caller with the last four, 5251. Please press *6 at this time to unmute yourself. Okay, moving on. Caller with the last four, 7946. Please press *6 to unmute yourself. Caller with the last four, 7946, giving you one more opportunity.
Hello, good evening. Can you hear me?
Yes.
Yes, this is David Aber. I've been listening to the people. I think some of the problem can be alleviated if they just start vetting the people in the transitional housing out here at Kensington. That would be a good place to start. And I understand we have a committee put together to come out here and check this out and get to the bottom of all the disinformation that's floating back and forth between the city as well as the people at Kensington. I have to commend the mayor for last week recognizing the civil rights violations out here with the mail. They have finally, after 15 months, got something that appears to be mailboxes, but they are still not functional, even though they've been built for about 3 weeks now. But you know, I'm just waiting for you guys to come out here so I can give you a tour, and maybe if you can make sure everybody's from SPA 1, because they're not, and I don't care who's telling you what, because I'm on the ground. I know where all the skeletons are buried, figuratively speaking. So I appreciate that the Vice Mayor and Councilman Doris, there's a committee put together, and with Heather's help and the site director out here, and I'm more than willing to donate my time to make sure everybody has their facts straight instead of the back and forth. There's a lot of people out here that are afraid to speak up when they don't have hot water for 4 months, things like that. And when there's a disconnect with the information, and I do want to commend the people that have reached back out to me. since the last meeting and prior to the last meeting. And hopefully we can get everything together, because the mayor stated he was disappointed. If he had a really good tour out here that I could provide, I think he'd be more than disappointed. But 3 simple things could be done to get us back on track. Just simply as posting the doors, to lock the doors for the permanent housing out here would alleviate a lot of the criminal activity that's going on out here. And thank you for your time, everybody.
Caller with the last 45251, please press *6 to unmute yourself.
Just simply as posting the doors, to lock the doors.
I'm ready.
For the
Yes, we can hear you. If you could, please eliminate your background noise.
Okay. What's going on out here?
Thank you. You may begin.
Hello. Hello, this is Kimberly Calderon, and I thank you once again for listening to me and taking the time out to hear all of our concerns. Yes, my concern is always about the homeless. I ran across someone who was literally ticketed for having their car being their only domicile, and their car was taken by the Lancaster version of the Los Angeles Sheriff's Department. Their only domicile was taken, and they were left on the street. The male had mental health disorders, and I can't stress this enough, as I did in the last meeting, that mental health is further escalated by homelessness. So keeping people in this way by taking their only money just to have their voices heard is kind of unbelievable. I expected better out of Lancaster. But what I really worry about with this particular ordinance is what is considered a quality of life issue. Is somebody going to see me, a minority single mother, walking down the street trying to get my health in order, and think I am a quality of life issue just for my presence? That is what I worry about, because out here in this area, as you saw during the summer, there is a lot of discrimination out here, and a lot of people are unfairly targeted anyway. To add things that could have them targeted more and then cause more of a financial strain during a pandemic is kind of out of touch. And I offered to give solutions and alternatives to Mayor Paris last year. I called for 8 months and never got my meeting. So I please beg of you, I am more than welcome to have that meeting again so we can address issues out here that can better the lives of all the people who live out here. Thank you again, and I hope everyone has a wonderful rest of their evening.
No other speakers at this time.
Okay, thank you for your comments. I do want to respond to the yes, it's true. I do have animosity towards the ACLU. I think they frequently deceive people. They exaggerate things like this. I see where they got people all wound up over the homeless, but out of 105 citations, 3 of them were homeless. This was never meant to target the homeless. It doesn't target the homeless. It's deceptive at best. And, when I was in college, I remember the ACLU being a much different organization. Their goal wasn't to deceive people. It was to protect people. And this is a work in progress, but it took a lot of people's efforts and creativity and innovative ideas to try to preserve accountability without putting people in the criminal justice system for less than serious crimes. I think the putting a cloak of a criminal history on somebody should be reserved for serious offenses. And that's what this is about, and it's a work in progress. And for the ACLU, I mean, they parade around, they raise money, they get suckers like me to write checks to them because they're preserving civil liberties. They're not preserving civil liberties. I'm not quite sure what they're doing. But to say that we should go back to putting criminal records on people, pulling them up off the street, putting them in handcuffs, take them to the station, and put them through that horror show while they wait days, sometimes months for bail. Seriously, you're the ACLU? You're not the ACLU. You're a bunch of charlatans. Why, if the ACLU was really about civil liberties, they'd be working with us. They wouldn't be painting this thing as an attack on the homeless, because it most certainly is not. But at the same time, Lancaster is never going to be a place where people can commit crimes without any accountability at all. And it has nothing to do with being homeless. Sorry, folks, I'm not persuaded. I'm actually disgusted that this is the approach you're taking. This is a really good thing. It's a work in progress. It's never been done before. It needs the creative efforts of the community to make it better. But what I heard tonight is just dishonest. So that's really all I have to say. Did I say too much, Allison?
It would be appropriate to close the public hearing.
The public hearing is now closed.
And we have a motion and second on the floor.
Then let's call the roll and vote.
City Council Member, Agency Director, Authority Members, Doris?
Aye.
Molly?
Yes.
Mann?
Yes.
Vice Mayor Chris?
Yes.
Mayor Paris?
Yes. And I would like to thank Lee DeRico and Jocelyn Corbett and Allison and the countless other people on staff and in the court system that have worked hours and hours to create this program that is really meant to save people, not to persecute people.
The motion passed unanimously.
Okay, thank you. But a good deed never goes unpunished. Isn't that the saying? Now, what are we?
We are to city manager's announcements.
City manager, let's hear your stuff.
Sorry, Allison, I think we skipped council reports.
I'm sorry, what? I didn't hear you.
I think we skipped council reports.
Oh, we did skip council reports. My apologies.
Okay, council, you got any reports? Let's hear them.
Sanitation District 14, the attorneys there said we can't give support of the $40 million that the Sanitation District has in reserves help to the restaurants. We did check it out as best we can, so we're trying other ways. I urge everybody to do the rebates, especially the restaurants, the water rebates. Your bills are based upon flowing of water, so they can see just exactly what the rebate should be. We're giving rebates back as large as $7,500 to some people, so it's important that everybody check it, especially the restaurants, to do that. Everything else, we're just about to meet again with the ABA QMD, the ABTA, so we're doing good things.
Okay, what have the rest of you been doing?
Well, again, I've been getting acclimated to a lot of the boards that I just got put in the High Desert Corridor, the, what's the other board I just was?
SCAG.
Yes, SCAG, Southern California Association of Governors. So already had a couple of meetings with them, getting very acclimated on what's going on. And again, Rex, your argument is very valid about how we are forgotten about. Me and myself and Santa Clarita had to kind of team up together to find out why they are investigating all the major traffic, but wouldn't investigate the Antelope Valley when the Antelope Valley tops New York and tops other states. We have the highest traffic right now, and we wasn't even included in the report. So this is one of those things that they could keep forgetting about the Antelope Valley, but we're on there to make sure that they understand who we are and what we are, and getting acclimated. I have a great staff. Jason and Trolise has done a great job catching me up on what's going on. So SCAG and High Desert Corridor, I will keep you posted on the things that are coming forward and what's happening.
Thank you. Okay, now we go to the city manager's report.
Thank you, sir. If you hadn't visited the website in a while, we have a new look with the new brand and a new style. Hopefully, make it a little bit easier for people. Updated, so go check that out at our website. It's the same URL. Go check it out, and it is brand new. So if there are some links that aren't functioning, please let us know. Email us, tell us, we can get those fixed up. But it's a shout out to the communications team. I know it's never easy to launch a new website, but they've done a great job. MOA has opened a partnership with LACMA, and they're open now, showing the California photography from the Los Angeles County Museum of Art. It's a fantastic show. Make time to get over there and take a peek at it. They do a great job over there, MOA, and it's a great way to get out, especially during these times, and stay COVID safe. 2 drive-in movies this month. They're going to be playing 42 and Selma in honor of Black History Month. So make sure to get out there and enjoy those 2 shows. Food distribution's coming in March. We're working closely with a number of different organizations as a staff to get that ready to go, and keep your eye on social media for those updates. In addition, obviously, social media is super important. The rebate that Marvin's talking about, we're doing a big push on our social media. So, our communications team doing a great job out there. So recommend everybody, log into your communications, sign up for our email, do those things, because it is a great wealth of information that you can keep up to speed on. And then the LPAC is having a virtual show for Valentine's Day. So participate in that. So as always, shout out to our staff and our team. Even in these trying times, they're out there trying to do what they can to continue to serve and continue to do what's right for the public. So with that, it's the only updates I have.
Thank you. Moving on. Now we have public comments, right?
Yes. At this time, anyone wishing to comment on non-agendized items, please press star 9. I will announce the last 4 digits of your calling number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please keep in mind, state law prohibits council from taking action on items not listed on the agenda. Please press star 9 at this time if you wish to comment on non-agendized items. No speakers on non-agendized items.
Well, Allison, you see that? I left them speechless.
Yeah.
All right. The next meeting is scheduled for Tuesday, February 23rd at February 23rd, 2021 at 5 p.m. Hope to see you all then. Remember, wear your masks, stay safe. This thing isn't over yet. Thank you. Good night.
Amen. Good night, everyone.
Good night, everyone.
Good night, everyone.
All right.
Good night.